Hello everyone, I'm Danette Kaplun from Hispanic Global, coming to you live from the Baptist Health Media Center. Vaping has always been a hot button topic, but lately it's been in the news quite a lot, so that's why we wanted to bring two experts to you to this Facebook Live. It sadly resulted in lung illnesses and death, and this isn't just a problem in adults, it's also in the younger generations. Joining us to discuss the growing risk vaping poses in both adults and teens and what we should be paying attention to as parents, grandparents, even friends is Dr. Javier Perez Fernandez, pulmonologist here at Baptist Health South Florida, as well as Dr. Fernando Mendoza, Medical Director of Pediatric Emergency at Baptist Children's Hospital. Thank you, doctors, for being here with us because this is such an important topic. We're all parents and we receive so many questions about this that we want to invite you to be posting your questions, your comments, any doubts that you have here in the comments because we will be reading them and the doctors will be answering them at the end of this segment because we have a Q&A. And we can always go back to your questions after the segment has ended, and that way we can address any concerns that you might have. So let's start from the beginning because a lot of parents don't really know what vaping is. And I would love to know what are the most common misconceptions that people have about e-cigarettes, vaping, the pens. There's so many names that are used when they're calling about vaping.
Fernando, you want to start?
Yeah, sure. Good morning, Janek. Thank you for having us. Yes. So vaping, what is vaping or e-cigarette use? Vaping is basically an electronic form of a powered capsule module that takes a liquid. Almost always, 99% of all the vaping liquids contain nicotine. And basically, it's something that's inhaled and it's used as an alternative to smoking combustible or normal, we call, kind of lit cigarettes. And it's a real problem. It's a real problem now in kids.
And for some parents who might not be aware, we're looking at it right now. They look like pens, like a USB drive. So parents might not be aware of what a vaping pen looks like, and they might ignore what it is. So this is not a cessation tool, right? Because a lot of people tend to say, oh, this is much better for me than just smoking anything else.
Sure, Jeanette, and thanks so much for the opportunity here. I think it's very important to convey the message to the parents and to the patients in general. The smoking cessation is a completely different program. It's a completely different element. It does not include the use of vaping. Now, some people in particular had the benefit or had maybe with some benefits in try to move people to quit smoking using these elements. These are not proven to produce any benefit on patients that are smokers and want to quit. On the contrary.
That's very important to know because that's an argument that a lot of people use. They say, oh no, it's going to help me quit smoking.
Yes, and all the scientific societies will remind people that no studies have proven that these instruments are in any way successful help. On the contrary, we've seen people that use these elements and they actually smoke more. They continue doing the vaping and they actually initiated in other products along the line. As Fernando has mentioned, it's very important also that parents realize that when you use the vaping instruments, and I'm talking those instruments that you've seen there on the pictures, there are many substances that can be added to there. So not necessarily sometimes, unfortunately, we've seen that people make their own mixes and their own things and they use those vehicles to inhale those. And those act actually more dangerous even, if I can say that.
Well, yes, actually, it's been a lot in the news. Dr. Mendoza, have you seen a lot of illnesses coming up in teens, like in their lungs or any respiratory illnesses?
Absolutely. The pediatric ER is kind of the entry point for these illnesses in the presentation. So just to pull back a little bit and kind of touch on what Dr. Perez Fernandez says, vaping and e-cigarette use or juuling is an introduction into nicotine addiction now for kids. It's an introduction. 97% of all vaping products are flavored e-cigarettes. These are targeted to kids, even though the manufacturers such as Juul and other ones say it's not. It really is used at the same tactics that were used many years ago by the cigarette companies to target kids with kind of the promotion of a stereotype or being cool. Now it's flavored. So these are introductions into nicotine addiction. We do see these in the pediatric ER. At the onset of respiratory symptoms, especially in asthmatics, even non-asthmatics, someone comes with coughing, chronic coughing, wheezing. Now it's not even a matter of, do you vape? It's a question we ask in the ER is, when was the last time you vaped or used a Juul? And
it's that prevalent.
And absolutely, 1 million teenagers admit to use the daily use of e-cigarettes. A recent article
that is a staggering statistic.
A recent article by JAMA in 2019 pointed out that almost 30% of teenagers have admitted to using e-cigarettes or juuling within the last month. It is not a matter of who, it's a matter of when. Your kids, your teenagers are being exposed to this. If they've tried it once, they're probably trying it many more times than that. And if they say they haven't seen it or they haven't done it, they have at least seen it. They've at least seen it and seen friends of theirs doing it. And really, the truth is, by the time you get to high school, it's too late. This is happening in middle school, 5th grade, 6th grade. By 7th grade, it's pretty widely exposed. So in the ER, we see coughing, shortness of breath. Coughing we can't explain in non-asthmatics. We admit these kids to the hospital. They're getting admitted to the intensive care unit. They're getting admitted into kind of monitored units and for a long period of time. So it's a real problem we're seeing every day. And if I were to go look at the census board in our pediatric ER at Baptist Children's right now, we probably see some kids who have some level of respiratory complaints that might be attributable to vaping.
And have you seen also an uptick in COPD?
Well, so this is very important, and that you mentioned that, Jeanette, and I think Fernando being here has been a key instrument for the public to understand this. So for many years, smoking has been the use of cigarettes most prevalently, right? And so smoking has produced health problems, but typically over 10, 15, 20 years. So we're seeing kids starting to smoke as early as the age of 9 or 10.
Right, in middle school.
Right, and producing the damages at the age of the 30s or the 40s, and that's what we're seeing typically now.
In the teen years.
Right, but now it's very important to realize that vaping is producing problems at the age that Fernando sees those patients. So it hasn't happened before, and that's the scary moment. We're seeing an increasing prevalence of using these products, and an amazingly increasing, unfortunately, number of patients that go to his ER, and that never happens with the smoking. So smoking produces damages, but it produces over time. We're seeing these elements produce damage right away. It can damage your lungs right away. It can produce severe problems right away. And of course, at a late point, I'm sure they will produce COPD. We don't know that because we don't have enough time to tell you, but I'm sure that it will be long-term damage on your lungs and long-term damage on your health. There is unfortunately no known yet. But what is really the scary and the strongest message that Fernando has said to all of you is how prevalent is this, and how many patients he's seeing, and his team are seeing now on our ER as it's happening everywhere in the nation and in the world, I will say. And that's the scary moment, because those are kids, their lungs are not necessarily formed completely yet.
Right.
Their brain is not completely formed yet. So all those damages might be completely irrecoverable. And that might happen at the age of 12, 13, 14, 15. So imagine how damage can this produce to people if we continue doing it.
It's crazy just to wrap my head around it, because COPD used to be a disease that tended to be seen in patients that were much older.
Right.
So just to think of the lifelong consequences that vaping can have over an entire generation that is starting so early. Now, for those at home that might not understand what COPD is, could you briefly explain how it affects your lungs?
Sure. So COPD will be kind of a long-term effect of any smoking product, and for all causes of COPD, we see 90% is produced by smoking. So any form of smoking. And COPD, what produces is a difficulty breathing, producing cough, producing phlegm, producing what we call dyspnea, so inability to practice exercise or even activities as simple as going to take a shower. Those things will happen, and it will happen after years of having your lung problems. And that happens typically, as I say, 20, 25 years after your initiation of smoking. Accelerating this process is obviously a very dangerous situation, and we're seeing, though it's not really properly called COPD, but we're seeing significant lung damage by vaping, and it's called now VILI, which is the vapor-induced lung injury. And that's a major problem, and it's caused even deaths of young people, teenagers, and youngsters. And I think this is very important to mention because vaping actually can kill you, and it can kill you right away.
Well, you both mentioned that vaping is a gateway and that it can be mixed with other substances. Is that where it can be lethal?
Well, I mean, the real vaping issue when it comes to Valley, vaping-associated lung injury, and by the way, like Javier mentioned, we have, 75, 78% of those patients, as recently as December 3rd, are under the age of 35. And there's been 48 deaths so far in the United States, almost over 2,000 admissions to hospitals, extended stays. Some of those deaths happening in Florida. So is it a gateway? Yes. Adolescent brain does not fully develop till 25 years of age. Adolescents are more susceptible to the reward, the kind of the reward centers, the effective reward centers that nicotine has. Become addicted a lot easier. A lot of these products, especially the ones that we're calling some of this Valley vaping-associated lung injury, have been associated with some THC containing vapes also. So there's off-market, black market, gray market products that have THC infused. What they're thinking right now is that the vitamin E oils that are mixed in with these vaping products, whether it's THC or nicotine, are what's causing a lung injury. These are micro or super nanoparticles that get deep in the lung that can cause sustained lung injury and an acute lung injury. So these kids come in, these young adults come in, and they start having difficulty breathing. And like Dr. Perez Fernandez said, it's not something that happens, 30 or 40 years from now. Something happens within hours, days, weeks. These kids are addicted. I mean, from firsthand experience, I've had patients in the ER and colleagues who have seen patients who these kids are 15, 16, 17 are addicted to nicotine and are smoking or vaping multiple times a day. And that is not only an addiction to nicotine, but it's a byproduct of that nicotine or that vaping product that can cause a lung injury.
It's mind-boggling, right?
Yeah.
First of all, but also there's another issue that people don't talk about. It's secondhand smoke. We know about the dangers of smoking and secondhand smoke. That's why there's been a ban in so many public places that you're not allowed to smoke anymore. But with e-cigarettes, a lot of people forget that there can be secondhand smoke, correct? Is there any danger for those who are around somebody vaping?
Yeah. So Jeanette, I'm gonna again elaborate a little bit on Fernando's statement, and I totally agree with him. And I think as again, just following the thread, I will tell that we don't know what those vaping contain.
Okay.
That's
a big issue.
That's correct. And the same way that we don't know exactly what cigarettes contain. And moreover, we don't know what happened when we ignite a cigarette because every cigarette might be different. In the same way with the vaping products.
And it has different chemicals.
Correct. And the amount of chemicals that are liberated from an e-cigarette could be as many as 1,000 or 1,200 different products. Some of them will make everybody scared. If I tell you that when you inhale a cigarette or an e-cigarette, you can be inhaling cyanide, which is a potent venom. Toxic.
It's poison.
That you can and you can be inhaling arsenium or lead or things that you will not even want to be close to them, right? So, but that happens. So the same way that we learn with time that passive smoking, what we call second-hand smoking, is obviously as dangerous or even more dangerous than first-hand smoking. We're assuming the same way, but unfortunately, sometimes we don't know because there's no real description and disclosure of what an e-cigarette contains inside because the companies that make them, they don't disclose necessarily, or what happens is that when we ignite, when we submit those cigarettes to the temperature that is produced so we can vape the product inside, many things happen. A reaction is called chemical reactions, and those things happen instantaneously. And that might be, again, targeting the lungs right now, producing these acute problems that we're seeing. But who knows how many other problems we're going to see in the future.
And as Dr. Mendoza was referring to, most kids, even if they're not vaping, they have been around other children who are vaping. So they are going to be exposed, and that's why it's such an important topic to address with even before kids reach the teenage years. In the tween stage, it's very important to start talking to your children about the dangers of vaping because they don't know, they think it's cool. Now, how can we keep that perception out of the conversation? Because kids see these colors, they see this flavors, all this marketing. How can we really tell them that it's not cool to vape?
Well, I mean, that's going to be a hard one to say that's not cool to vape. It's almost like, back in the day it was, smoking in the boys' room with the famous Motley Crue song, right? It's kind of cool to, to break the law and go against conventions. That's what teenagers and preteens want to do and be included. It's very attractive. These are flavored vape products. They taste like bubblegum, cherry, all kinds of things. They're very attractive, and the kids don't think it's harming them because it's fun. It's, and the nicotine gives them a rush. So the best way to approach it is to talk to them continuously, constantly. Don't ask, do you vape? Have you seen? Say, when was the last time? What do you mean, Mom or Dad? When was the last time you were around someone who's vaping? When was the last time you tried a vape product? Mom, I didn't try. Are you sure? When was the last time, in the bathroom at kids' schools, at any kind of party, any kind of social event, even not, in the classroom. There are kids vaping in classrooms. The vapor that's emitted from the exhalation of the vape is so nondescript and either it smells like nothing or smells fruity that it's almost imperceptible, especially to teachers or even your classmates. It's happening in classrooms. As you saw in the picture a little earlier, they look like little USB ports, especially the juuling. So assume that it's happening in the 4th, 5th, 6th grade. By 7th and 8th grade, it's out there. It is out there. If you see, and so I would recommend to parents, talk to your kids often about this. Just like texting and driving, it becomes an issue when the kids are driving.
Right.
Talk to the kids constantly about this. Be visual about it. Go online. There's plenty of pictures, unfortunately, of teenagers, young adults who are in ICU settings, who are dying from this, and so this is what happens to you. Kind of extreme or tactics that really get their attention. Show them what vape lung looks like.
Which is like popcorn, right?
Yeah,
Really,
they know that lung failure, respiratory failure has a really ugly look to it. Be really constant about it, persistent about it. Assume they're around it, and talk to them constantly. Say, listen, if you're doing it, let me know. We can talk about it, and just really talk about it. When the statistics come out every week, every other week in the news, there's news from the CDC. There's news in our local news on the ABC, whatever ABC, NBC, the big networks. Baptist Health has a really good, in terms of awareness for the community. Show those items to your preteens constantly. Talk to them constantly about it, because at the end of the day, they don't know what's going to hurt them. You do as a parent.
And there's so much that we don't know, right?
Correct.
So
Correct.
On the preventative side, it's so important. Now, for those parents who might not be familiar with what happens when you vape, and they might suspect that their teens or their children are vaping, are there any symptoms that they should be paying attention to?
Well, respiratory symptoms are one of the first ones. More coughing, a persistent cold, but certainly the addictive behaviors that you see in your child, they say that something's not right with my kid.
Like their personality changes?
Personality changes, they're becoming more moody, they're changing their schoolwork, anything. This is an addictive issue. This is a drug. Nicotine is a drug, just to be really clear about that. So if your kids are exhibiting behavior that's not normal, that's not normal for them,
right,
out of their character, personality-wise, they're becoming more withdrawn, they're not talking to you as much, which is hard to discern sometimes as you enter the teen years, but their grades are slipping. Their group of friends becomes more selective, and you kind of aren't really, if you have those kids over the house, have those kids over the house. See what their interaction is like. It could be happening in your house, but if you're there watching them, but certainly those are the personality changes, the mood changes, their grades, anything that's kind of indicative of an addictive personality or addictive behavior. And then respiratory symptoms that don't go away. It's more than just a cough or a cold.
Exhaustion, maybe?
Exhaustion for sure. Mood changes. This affects learning, mood, attention. Nicotine is very addictive, and these vaping products contain a high, way more than normal cigarettes. Sometimes up to 20 times more.
Wow, I did not know that.
Yes.
20%, and you're vaporizing that and then inhaling it all. So there's like no waste or anything.
Well,
it's all going into your lung.
And it's super ultra fine particles that get deep in your lung. So, and don't do it alone. Don't talk. As a parent, don't have to take this burden on alone. Utilize your pediatrician, other influential members of your child's life, whether it's aunts and uncles, grandparents, other healthcare providers, the school administration. If you're a parent and you see your school's not doing much, it's in the schools. It is in the schools. There's going to be parent assemblies. There's going to be schools, assemblies with the kids. There's going to be even personal accounts or kind of testimonials by people who've used vape products and gotten very sick that you can find online, that you can find. So don't do it alone. These kids love YouTube, right? There's going to be tons of stuff you can find on social media that talks about the perils and the dangers of vaping. Don't do it alone. Use a multifaceted approach, multimedia approach, okay? They don't want to hear a lecture from mom or dad, but if you start showing them stuff and start bringing up, whether it's printed or social media materials that kind of talks about the dangers of vaping, they'll start to pay attention eventually.
And how important is it to partner with physicians, with doctors, so that way parents don't feel so alone in this? How should they address it with their pediatrician?
Pediatricians are your frontline help on this, and you can seek out help from your pediatrician, especially if you think your child has an addictive problem or something. They're hooked on this. Your local pediatrician or your child's pediatrician can definitely help direct you, or family practitioner can help you direct to resources. Have them talk to the patient alone in a room about this, so it's not just mom or dad lecturing, but certainly involve them and get them invested, engaged in your child's healthcare.
Now, have you seen parents who actually vape with their children thinking that it's harmless?
So it's a great point, and I think the best way to change your child's behavior is to model great behavior. So if you're vaping because you're nicotine addicted to cigarettes, you started with your teenager, whenever, you obviously shouldn't be doing it in front of your kids, and not even in front of your kids, because that stuff ends up on your clothes, in your hair, on your skin. Your kids, especially babies, can breathe that in when you're holding them close to your body. So lead by example. It's tough. I mean, there are other smoking cessation products out there, or there are smoking cessation products and programs, including, although I'm not an expert in that, nicotine gums, other things that you can kind of get the nicotine out of your system little by little without vaping, because that is going to be something that your children are going to see. Well, if mom or dad does it, it must be okay.
Now, with smoking, we've seen that over the years, some of the damage can be reversed. Do we think that maybe the damage can be reversed somewhere along the line if a child or a teen were to stop vaping immediately?
Again, I mean, unfortunately, smoking, though we have a lot of knowledge about what happened with the smoking, we cannot really make it parallel to vaping in some aspects. So smoking is related to what we call is dose-related damage. Okay. So it's given to you by the time that you have been smoking, the amount of cigarettes that you have smoked. But unfortunately, what we're seeing with vaping is not necessarily that. We've seen, as Dr. Mendoza has mentioned, we've seen damages that happen rapidly in kids. And that doesn't go necessarily with this relation between the dose that you consume and the number of years that you've been using these products and the damage. But it's very important that you realize that any damage that you produce might not necessarily be totally reversible, but it can be compensated if you quit the major damage that you're making it, which in this case is smoking or vaping. So the moment you quit vaping, you have a chance to make it better. But you don't quit vaping, you don't have a chance. So that chance is gone. So no matter what damage you've made, no matter how much damage in your lungs you have because of smoking or vaping, you can definitely make a change in your life if you quit. And this is more even special in the kids and the teenagers because they have a lot of lifespan ahead of them. Mm-hmm. So it's very important to do this as soon as possible. We've done a good job, I think, as a society to quit or make people quit smoking or make smoking diminish as much as the prevalence. And we've done a good job. Unfortunately, this is being reverted now with these new products. Mm-hmm. We're seeing an amazing amount of people that are smoking. And smoking not only just the e-cigarettes, but also the normal products, what we call normal tobacco products. And that is because, again, this is an entrance port to start using other products. As Dr. Mendoza has mentioned, it's very important to understand nicotine is addictive. It's a drug. And it produces addiction. And it produces you to go and seek for the next product that will deliver something like nicotine to you, whether it's an e-cigarette or it's a cigarette. And that's going to happen. For the adult population, and especially because we haven't mentioned that, and it's also very important, they need to understand that smoking is, or using e-cigarettes is not a substitution for smoking. It's not better.
And it's not a tool, as you mentioned,
absolutely.
For cessation.
And the most important thing is just, if you want to compare this, you have to understand, I'm going to jump from the 40th floor, or I'm going to jump from the 20th floor.
You're still jumping.
Right. So it really doesn't matter whether someone is telling you, oh, this is better than the other. It doesn't matter. It's as bad as, or maybe worse. We don't know. But for sure, we're going to learn a lot of bad things. We already learned the hard way with the kids and the teenagers. We're going to learn the hard way with the adults too. So very important people understand it's not good. And it's not good for you or the people around you.
Plus, you're trading in one addiction for another addiction. So that is something that I also think we need to keep in mind for anybody who is going to stop vaping. Always keep in mind that you will have withdrawal symptoms according to what you have described, since it has such an addictive effect on your body. So just to be aware of that. For parents also, it's important to know, because even if your teen decides to stop vaping, right now, he or she might go through certain symptoms that you are going to have to help them along the way so they can continue on this path. Addiction is real. It's difficult. It can be managed. It can be treated. But since kids are starting so early, we need to keep that in mind. Now, we have a question from a viewer. When do you recommend talking to your kids, and should you refer to vaping as a drug?
I would say yes. And I would say absolutely yes, because nicotine is a drug. And, our society only, not recently, but, we've had over half a century of research into smoking tobacco products. And it took a while for that tobacco industry to kind of let go. And we've really fought, legislation and the leadership eventually got to the point where, hey, it's an addictive drug. It's a drug, absolutely.
Well, and it's being banned in many states as well.
Well, yes, and so it is a drug. Nicotine is a drug, and that's the addictive component of any e-cigarette. 99 point something % of all e-cigarettes have nicotine in them. So the Juuls, and then so when you talk to your kids, it is a drug. It's a drug that's going to become addictive, and you have the addictive issues with it, which is seeking, which you're going to you have kids start looking for their next hit, kids stealing from their parents, trying to find money. How to buy the Juul packs or whatever they're buying, and then you're leading right into it. It's very, very easy to get, and it's out there right now in the middle schools and high schools, that the non-commercially available vaping products that have THC in them, which is marijuana, and the addictive, the kind of that will get you high, that's out there, and that's what the high school kids are using. So it is a drug.
Very important to keep in mind, even if they're not mixing it with THC.
Even so, and the thing I wanted to point out is that 70% of the people who are dying and getting sick from in the crisis right now for vaping associated lung injury are under the age of 35. This is a young person's problem. We don't have 50 or 60 or 70 years of data to know what's going to happen in 2040 or 2050. Who knows? We may see a whole generation of lung damage that is irreversible. We have over half a century of data and studies on traditional tobacco products, and here's where we are. People are still dying from that. So this is a young person's problem, and whether they're 20s or 30s, and they're out of the house, and your parents, now. So this, I hope Facebook, hopefully we're going to share this on Instagram and wherever we share it.
We're going to share it everywhere
because we know 20-somethings aren't on Facebook, but we'll get there. This is a young person's problem. This is a young person's problem for sure.
And the time to act is now.
Now.
Right. The time to act is definitely now. But again, though I totally agree with what Fernando said, it's a young person's problem now.
Yeah.
But it will be an adult problem later, and it probably will be more than likely will be a very bad problem, because if it's as bad right now as starting to use these products,
10, 15, 20
it's
years.
going to be horrible. It is going to be horrible. So we really need to make a very strong statement to explain to the parents. They have to look for what their kids are doing. Communication is important, as Fernando said. Talking to them and trying to understand what this is about, and not trying to concede this is like it's a minor problem or it's a minor issue, because it's definitely not.
It's not, and it's affecting adults too, because they are confusing it with a cessation tool. Right. So any last thoughts on
Talk
vaping?
to your kids, talk to your pre-teens, talk to your tweeners, 11, 12 years old. You have to be having this conversation already.
Even at 9, I would say.
9 to as young, it can never start too young. I'm already talking to my 7-year-old about it.
Yes, and trust is built over time, so it's very important to start really early.
I agree. I mean, I totally echo Fernando's words, and I say talk to them. It doesn't really matter how early you think it is. I think they're exposed to these products very early in their life, so just do it. Just do it.
Yeah, I agree, and thank you so much, Dr. Mendoza, Pere
Thank
Fernandez.
you for having us.
And remember to follow us on social media. Our handles are right there on your screen, and you can follow us on Facebook, Instagram, Twitter, and LinkedIn, where you can find health news and events at Baptist Health South Florida. And you can visit our website at baptisthealth.net/news. news. Thank you so much for joining us in this Facebook Live. We will still be reviewing all the comments and questions that you have and that you left. And remember that you can always trust Baptist Health South Florida to have the answers to your questions and the best specialists. I'm Janet Kapluan. I hope you enjoyed and learned specifically from this Facebook Live. You can find more tips on my blog, HispanicGlobal.net. Until next time, thank you so much, doctors.
Thank you.
Thank you.